Alright, this is Cynthia Allen, and this is my bone video on the axial skeleton. First we have the frontal bone, the parietal bone, the occipital bone. The occipital protuberance is here, and that is where there would be muscle attachments. Then moving on, we have the temporal bone right here. We have the temporal mandibular joint, which is right here. And you can see it would be helpful to have that so that we can move our jaws up and down. Mastoid process is actually back here. And then we have the styloid, which would be on the inside part in here. And it would be where the tongue and some neck muscles would attach. Then we have the squamous part, which is the most anterior part of the frontal bone, and we would also know that as the forehead. Then we're going to move on to the inside of the skull here. First I'm going to show you the sphenoid bone, which is right here, and then looking at it from the inside, just open up the skull there, and we're going to see some stuff on the inside. First, the superior orbital fissure is right here. It's right in there. You can see that little hole there. Then on the inside here, we're going to be looking at the lesser wing and the greater wing, which would be this little, if you can see that little like bone that comes out. So the lesser would be on the bottom part away, and then the greater is on the top. Then we have the optical canal, which the optic nerves pass through, but we don't have an actual canal in here, but it would be coming from the eye area or into the eye area, however you want to see it. Then we have the sella turcica, which would be on the inside here. Also, it would come out on the inside part of the eye here, inside part on the eye there, and the sella turcica in here, the eyes sit in there. Moving forward, we got the ethmoid, which is right here, right next to the lacrimal area. And looking inside again, you can't really see it, but the crista galli would be right in here. And this helps secure the brain to the cranial cavity, actually. So it's a really important place. The cribriform plate is actually would come from the nose, and it's the olfactory nerve that comes up in there. Moving on, we're going to go on to the sutures. So we have the coronal suture, which is this part. This is the frontal bone. This is one parietal, and this is the other parietal. Then we have the sagittal, which is between the two parietal bones, and it actually follows down to the occipital area here. So then we have the lamboid suture, which is this suture right here, that is between the parietal bones and the occipital bones. And then we have the squamous suture, which is this one right here, that would kind of divide the temporal bone there. And moving on, we're going to look at the facial bones. Let me move Mr. Frankie here. Alright, so we have the maxilla and the alveolar process, which is actually this area right in front, right above the teeth, and right here on the bottom of the teeth there. The nasal bone, which is this right here. Then you have the zygomatic, which is this right here, and the two bones that meet to make the zygomatic arch is the zygomatic process and the bone of this process and the bone of the anterior surface for the zygomatic. They form the arch. Then you have the ethmoid, which is in here next to the lacrimal, and the vomer is actually the ethmoid and the vomer form the septum here. So the ethmoid, it comes out here, and then the vomer, they meet and they make the septum here. And then you have the inferior nasal concha. That would be on the inside, and it's really hard. You can't really see it, but what it is, it's also known as turbines. They're kind of like on the edge of the nostril, or inside here, the nose, and they're also known as turbines because as the air passes through there, it changes against the mucosa, and then it kind of creates moisture and warmth and cleansing as it goes through it. And it's actually like a labyrinth looking thing that goes in there, so it's kind of like getting filtered as it goes in. Next, we're going to look at the mandible, which is the bottom part of the jaw here. Okay, so there's the mandible. It's the bottom jaw. We have the body of the mandible, which is this, and then the angle, which is this right here. That's the angle. Then we have the ramus, which is the back here. There's like a little indentation here. That would be the ramus. It's kind of hard to see on film. Then continuing on, you got the mandibular condyle, which is the first pointy bone here. And then you have the mandibular notch, which is this area that's between those two. It's like this little groove area. Then you have the coronoid process, which is this other point on the jaw. Now we're going to talk about the vertebral column. I'm going to pause this video now and to move my skeleton onto its back, or to its frontward, so we can see the back. Alright.